About dental and vision options by popular demand. A lot of people want to know how that works in terms of Medicare, Medicare Advantage, Medicare supplements, original Medicare, Affordable Care Act, your employer plan. So, I'm going to talk a little bit about dental and vision and all of your options. And then this is a live broadcast. So, the dental and vision should take about 10 or 15 minutes to talk about that, and then I'll open it up for all questions. So if you have any questions on retirement, disability, survivor benefits, spouse benefits, want to make sure you're receiving all the benefits you're entitled to, you, your family, or friends, you're about to file, you don't know how to do it, make sure you ask all your questions. If you don't have any questions today, make sure you subscribe, and that way you can find us in the future. Okay, let's go ahead and get started. So if you're watching this on a recording, yeah, make sure you subscribe. There's so much stuff out there, it's hard to find. So where was that guy again? That one guy that did that one guy that, yeah. Anyway, so here I am. All right, so we're going to talk about dental, vision, and a little bit about hearing. With original Medicare, if the frequent viewers of my channel know that I believe original Medicare should also cover dental, vision, and hearing. I mean, how healthy can you be in retirement without being able to see, eat, or hear? So, for some reason, I mean, it took us years to get prescription drugs in part of original Medicare. We finally got Medicare Part D prescription drugs. It took us decades. So now our next job, I would argue, would be to include dental, vision, and hearing in original Medicare, but it ain't there yet. So we have to come up with some other options. Original Medicare pretty much doesn't cover all of that, dental, vision, and hearing. It does to a very, very limited degree. If you have risks of glaucoma, then you can get glaucoma testing under original Medicare. Hearing exams, limitations there as well. So but what we traditionally think of as dental benefits, cleanings and fillings and stuff like that, x-rays, no. So original Medicare just doesn't cover it. It doesn't cover hearing aids, doesn't cover glasses unless there's some type of surgery you had and you needed corrective glasses after the surgery. But original Medicare, unfortunately, until y'all demand your politicians at it, it doesn't. So what a lot of people do is if they have original Medicare, they also fill in the gaps, because original Medicare, as everybody knows, original A and B, it's great, no networks, no pre-authorizations, but there's a lot of financial gaps in there that you are responsible for. The biggest one being the Part B co-insurance, where if you go into a hospital and have a $100,000 bill, you have to pay 20% of that, $20,000. So original Medicare A and B, almost everybody, unless you're independently wealthy, got a few $1,000,000 sitting around, almost everybody gets either a Medicare Advantage plan or a Medicare supplement plan. Those are the ones with the letters F and G and N. So if you get a Medicare supplement plan, then pretty much you don't have any vision, dental, or hearing benefits with those. Some plans nowadays, the Medicare supplement plans, they are offering, it's not like traditional insurance. A lot of those big companies, also offer Medicare Advantage plans, and they have networks of dentists and, eye places. And so they say, okay, well, as part of our Medicare supplement, we'll kind of give you a benefit if you sign up for us. It's just basically a discount with their particular providers. It's not truly insurance. It's just you get a 10% off or 20% off or something like that. So, but Medicare supplements really doesn't cover dental, vision, and hearing. A lot of employer plans don't cover vision, dental, or hearing as well. So the plan I'm going to recommend today, you can get it if you have an employer plan. You can get it if you have a Medicare supplement plan. You can get it if you have Affordable Care Act. Any one of those. I've looked around. A lot of people wanted a recommendation on a good plan. So I've looked around and found one that I think is probably the best out there. In terms of if you have a Medicare Advantage plan, then a lot of those do have some level of dental, hearing, and vision. Some are better than others. Some are, they look good on paper, but when you go to use them, they're not that great. But it really depends on where you're at and what plan you're on and all the rest of it. So Medicare Advantage plans, those are the ones that it's also called Medicare Part C. Those, a lot of those have zero premium per month, and they offer, the dental, vision, hearing, some type of gym membership, and all the rest of it. Um, uh, the people that watch my channel know that I recommend Medicare supplements if it's in your budget, because you don't have pre-authorizations, you don't have networks, so you don't have to deal with getting permission from some insurance company. Your doctor doesn't has to ask permission from insurance companies to do whatever they want to do. But Medicare Advantage, pre-authorization, rationed care in a lot of respects. But if a Medicare supplement isn't in your budget, a lot of people just get a Medicare Advantage plan, which is fine, but you've got a lot more work you have to do over the years and keep up with those, because all those plans are only good for 1 year. People tell me all the time, says, "Oh, I've had my Medicare Advantage plan for 3 years." No, you haven't. You've had it since the beginning of this year. They change every single year. Sure, you might have the same card, it might still be a zero premium, you might still have your same doctor, but everything else underneath there, you don't know until you don't know. Once you fall or get sick, or then you go in there and say, "Wait a second, my plan? No, no, that was a plan 2 years ago. This is the plan that's been effective." So you have to keep up on those. You have to keep up on it. And this year is going to be the biggest one. Next year are going to be the biggest changes we've seen in a long time. It's kind of a perfect storm, a perfect bad storm of all kinds of things happening in the industry. So Medicare Advantage plans are really, really going to change next year. But in terms of, and one of the things is, a lot of people get those Medicare Advantage plans and they get it. They unfortunately don't focus on the medical part of it. They focus on the bells and whistles, the goodies. And then when they get hurt or something, it costs them a lot of money. But they've got a gym membership. So make sure you focus on the important stuff and the extra stuff. One thing that the insurance companies have been making a lot of money on is they have been offering all these bells and whistles for these Medicare Advantage plans, and people, haven't been using them. Go figure. Get a gym membership and not use it, huh? Go figure. I think that's the gym membership. That's their operating procedure, right? Um, so the government has finally come down and said, okay, starting next year, 2025, Medicare Advantage plans, you have to send a letter to everybody in your plan mid-year that says, "Hey, you've got $1,000 of dental, and we notice you haven't been using it, and so just want to let you know." Or you've got, hearing aids available, or if you got gym membership, or you've got one of those flex cards or grocery cards, and you haven't used it. So this is a good thing. So a lot of people sign up for those plans, and the agent or broker doesn't fill them in, doesn't help them, and that's the reason they signed up for this plan. And the insurance companies may make it difficult, or people just don't know about it and they don't use it and they lose all that money. So next year, in the mid year, you're going to receive that letter, and it'll tell you exactly what you have. So, but the trick is to use it as soon as possible. Go through your plan, reach out to your broker agent and say, "Hey, by the way, what does my plan have?" And the trick is, one of the tips I recommend is, if you have some type of expensive dental procedure, or talking about vision or hearing or whatever the case may be. Usually it's dental. But if you have some expensive dental thing, and then let's say it's, the doctor says, okay, it's going to be $6,000. And you say, "Oh, I just don't have $6,000." But your Medicare Advantage plan has $3,000 max available in there. So what a lot of people do, and dentists know this, they schedule you for the end of the year, November, December. They do $3,000, half of it, maybe your upper teeth, and then in January, hopefully when the new plan comes out, and it still has that $3,000, then you do the lower part. and then you've got it all. So you kind of break it over into 2 years to save yourself tons of money, and use the benefits because, as I always say, these companies, insurance companies, they don't get to be billion-dollar companies by giving you stuff for free, right? None of this is free. Actually, Medicare insurance brokers are, it's illegal for them to say a zero premium plan. This is a free plan. It's illegal to say. So if they say, if you ever, everybody here, if you ever hear anybody say this Medicare Advantage plan is free, then that's a shady character. They're not supposed to say that. And which is good because it's not free. All those decades you paid into Medicare through your FICA taxes, all that money went to Washington or Fort Knox or wherever they keep it in the chock full of nuts can out in the backyard, wherever they keep it. They actually keep it in special trust funds. But anyway, but that's your money sitting there. And then when you sign up for a Medicare Advantage plan, that company, XYZ Medicare Advantage plan, goes to Washington with their cup and they say, hey, John Smith just signed up for our Medicare Advantage plan. Give us that person's money. So all that money you paid into FICA, Medicare, all those years, the government gives it to your company, and that's what the company uses to take care of you. And that's one of the things that it's going to be big this year because CMS, the Center for Medicare and Medicaid Services, the government is giving less money to these companies. And there's these restrictions about people are probably going to start using those benefits because they're going to get that letter. So these Medicare insurance companies, they don't get to be billion-dollar insurance companies by being stupid. They're going to start cutting back benefits. We pretty much see it, the kind of the writing on the wall. And so if you have a Medicare Advantage plan, when October comes around, when the new plans come out and you see your plan, you'll get a letter. It's called the ANOC, the Annual Notice of Change. It'll be in September and you'll get it. And most people just look at it and says, oh, it's still free, zero premium per month. And it still has my doctor. Okay, I'm good. And they move on. Now, the insurance companies know that's basically the only thing you look at. So what they do is a lot of them change all the other stuff. Okay, last year was $100 a night if you went into hospital. Next year we'll do $400 a night. Last year was $50 for an MRI. Next year we'll do $200. So yeah, you'll be surprised if you don't do the right thing. So reach out to your broker, agent, whoever enrolled you. If you don't have anybody to help you out, make sure you can reach out to us, and I can find someone that works your particular state because they're all local, state specific. And we can find someone, or just send me an email and say, hey, Ed, put me on your list for October. And when the new plans come out in October, give me a call and review what I have with all the other new plans out there. And we can do that with no problem whatsoever. So the where to get dental and vision, and actually some hearing. I've got a link in the description of a company I've found that I've been working with for a while. And they've got a super large network, really easy plans to understand. You just go in there and type in your zip code and you put, do you want vision and dental? And you put, if you just want dental, it shows you 3 or 4 options of dental. It tells you how much is covered day one. It tells you how much covered after, 1 year, deductibles and all that kind of stuff. And it's kind of like buying something on Amazon. Then you just put it in your basket and check out. Very, very easy to enroll, get your plan, and a very easy plan to understand, and humongous network throughout the country. And there is even, a lot of these plans don't offer this, but this also has a component of hearing in there as well, hearing exams, hearing aids, and all the rest of it. So you can get dental, vision, and hearing with one stop. So I'll put that in the description. And full disclosure, if you enroll through the link, then that helps this channel and helps us provide all of this free information pretty much every day recently. Okay, that is it for dental. If you've got any other specific questions, make sure you ask, but I'll stay around here for about 45 minutes and answer all your questions on Social Security, retirement, disability, survivor benefits, spouse benefits, Medicare, Medicaid, the Affordable Care Act, all of it. So let's see what we got here. Martin. Dr. Ed, I am on SSDI, and last week I had a procedure on my lower back to control my pain. Will this affect my benefits? Absolutely not. I would recommend that you make a note of that. And everybody, should kind of keep an eye when they're on SSDI or SSI disability. That way, when the CDR comes around, your continuing disability review, you've got proof, so you can write that down in the CDR paperwork they send to you to confirm that you are still disabled. So, but yeah, in terms of procedure, no effect whatsoever. Hopefully you're feeling better. Taken took. um Want to work under FRA but over 60, able to collect deceased ex-spouse benefits, married. Okay. Worker under FRA, but over 60 and able to collect deceased ex-spouse benefits, married over 10 years. Yeah, I'm not sure if that's okay. Second part of the question. Worker earned more than deceased ex almost every year, so worker's own benefit will be higher than X's. We've got three. Worker still needs to be employed in order to support son who will still be under 26 and still needs health insurance. Okay. All right. Doesn't seem like there's a question there, but all right. A lot of people living on just Social Security can't afford a Medicare supplement. Hopefully, my advantage stays good. Yes, yes. That's why I always say, if your budget can afford it, then, I recommend a Medicare supplement. But yeah, if you just don't have it in your budget, you just don't have it in your budget, unfortunately. So, but yeah, if you keep up on your Medicare Advantage every single year, remember that's your money. So they're not giving you anything just because they're nice. So get your money. Okay. Wow. Take and took. Okay. If worker applies for deceased benefits at 60, are they reduced by any amounts that the worker makes above a certain amount? So if someone takes benefits at 60, yes, they are reduced because they're taking it earlier. All right. So yeah, we've got. I think Taken needs to schedule an appointment with me. Long questions. If I sign up for an Advantage plan because of zero premiums, can I switch at some point to a Medicare supplement if the Advantage plan doesn't work? Yes, but it's difficult depending on your state and situation to go from a Medicare supplement to a Medicare Advantage. You can do that anytime, during the annual enrollment period at the end of the year. But to go back to a Medicare supplement, there has to be certain preconditions. If you're healthy, because you have to pass the health test. It's not really a test. It's just health screening. The agent or broker, which I always recommend brokers, because most agents, a traditional agent, they work for one company, so they'll only give you one option. Here's the best one. It just happens to be my company. But a broker works for you. They contract with a whole bunch of companies in your area, insurance companies, and they just tell you which one they recommend. And doesn't matter to them which one you sign up for. It's all the same. So I always recommend a broker. So the broker will ask you about 30 or 50, 60 questions, depending on the company. And if you answer no to them, you're healthy, then you can switch pretty much anytime. If you're in a particular state, some of the states have birthday rules and anniversary rules. And if you're in a Medicare Advantage, there's a trial right period that within the first year of signing up for a Medicare Advantage, you can change your mind and go back to original Medicare and then get a Medicare supplement at that time. So super long story short, there's a lot of times you can switch to a Medicare supplement, but it's sometimes the laws, and they're all different in all states, are more difficult to follow. So yeah, reach out to a broker, reach out to us, and we'll see if a Medicare supplement plan is right for you. Terry Kim, my mother has Kaiser Advantage plan and it seems fine. I don't understand the issues. Is Kaiser different from your general critique? I have had Kaiser for 15. Yeah, I don't want to talk bad about any particular company, good or bad. I don't talk about any particular companies at all in any of my broadcast or anything. I always say XYZ Medicare Advantage plan. so I don't like talk about that. But yeah, it's interesting. Um, there's people that think Medicare Advantage is the worst thing since male pattern baldness, I guess. But if you look at the statistics, over 50% of people in America are that are eligible for Medicare sign up for Medicare Advantage plan. I think it's budget, obviously, um, but and then over 50% of those people are happy with their plans. But you've got people out there that says, "Oh, they're the worst thing ever," and says, but yeah, I think there's also an element of that is nothing's really happened. Um, you've been healthy, so you don't have any issues. Because if you know for sure you're going to live the next 50 years and you're not going to get seriously ill or injured or anything like that, 100% yes, get a Medicare Advantage plan. Absolutely. Zero premium per month, bells and whistles, keep on that forever. However, if something should happen next year, 5 years, 10 years from now, and you need to get some type of operation or procedure, do you want to deal with the delays and the denials? And so, yeah, if we had a crystal ball, I could tell you exactly, but unfortunately, we don't. So, those I should have been using. My Anytime Fitness membership, I do use vision and dental, only a few $100s for cleanings. Hearing is good, no drugs, which are not good for the body. Yeah. Yeah. Yep. Definitely go out there. That's how you get, you stay, and that's how you get all your money back from Social Security. People always say, when should when should I start my Social Security benefits? Or 62, 65, 67. So it's all about, genes and, your health and all that kind of stuff. But if you eat well and work out, then you'll get more money from Social Security and Medicare and all that stuff. So that's one way to get all the money. I need to start practicing what I preach in terms of diet and working out. So, but I'm anyway, I'll work on that as well. I hope my Advantage don't cut back. It comes with $7,000 for any dental work you need. I'm currently with minimal teeth left, but I have, wow, and $7,000. So yours is probably a Medicare Advantage dual eligible plan. Those are the ones for people with Medicare and Medicaid. And because those people have Medicare and Medicaid, and they also have the extra help with prescription drugs from Social Security, and so Medicare Advantage companies are able to offer those people a lot more benefits. So that's why, yeah, $7,000. Yours is probably a Medicare Advantage dual eligible plan, but those change every year as well, and there's a lot of competition in your area. Your company that you're with probably has 5, 6, 7 different plans, and other companies are always trying to compete. So last year your plan was the best plan, and you know next year they might reduce that dental, and another company comes in and increases it. Or your company, what often happens is because they know people don't check their plans like they should, like the government and everybody recommends that you do. So what they do is your plan might be XYZ 1.0, and next year they'll come out with Medicare Advantage XYZ 2.0, and they'll let your benefits deteriorate a little bit and give that $7,000 or $8,000 to another plan, a newer plan, because they know that a lot of people won't shop and get the best plan. So that's what they're planning on. So I'm going to do a video, and I think I put it down, how to make rich people richer, how to make give your money away to billionaire companies. That's how you do it. So if you want to know how to donate your hard-earned money to billion-dollar companies, that's exactly how you do it. You don't check. Constance, is the $22,320 I am allowed to earn this year without penalty calculated for calendar year, or could I earn it all in 1 month? Wishful thinking, but I'm sure you get my point. Yeah, it's all if it's for the entire year. So if you make $22,320 in one day, then yeah, anything over that for the rest of the year is going to be withheld $1 for every $2 you go over. But that's not the first year. So if you start your benefits at 63 and you make $1 million, but you don't start your Social Security benefits until July, they don't look at the $1 million. They just look at July going forward, and you have a monthly test. Is a healthcare broker, aka navigator? If not, how does one locate a broker? Yeah, give us a call. Call that number, email me, and give me your name, phone number, the state you're in. Again, they're all state specific, and say, hey, I need someone to help me now or in October, and see if I'm in the best plan. And that's the only people I get is brokers. I don't deal with agents. The old, Henry Ford. You can have any color car you want as long as it's black, right? So give us a call and we can find someone to help you out. Tim, retired 2+ years, wife plus son, born abroad, live in the Philippines. She never lived, work in the US. Is she child eligible for benefits when I'm gone? How do I ensure eligibility? Yeah, the only issue is citizenship. Have to be U.S. citizen or green card holder. And there is um, you can go on to the Social Security website and click on, or you just Google payments abroad screening tool. So payments abroad screening tool. And you can put the information in, and they're going to file for retirement benefits or survivor benefits. And because all the countries have different totalization agreements with the Social Security, so it depends on what totalization agreement Philippines has. But yeah, pretty much you have to, if they're US citizens, no problem, start your benefits. Green cards, a little bit different, but if permanent resident, then that's fine as well. So check that out and put in. But in terms of Social Security, yeah, if you paid into it, obviously it sounds like you paid into it and you're receiving benefits or whatever, then they will receive 75% of your primary insurance amount, which is your amount at your full retirement age. And but your wife will have to be 62, or if at that time your son is under 16 and under, she can collect what's called auxiliary child and care benefits, and that'll be 75% as well. Why does Medicare count resources? ACA goes off income only. Yeah, Medicare doesn't count resources at all. I got good ACA until I turned 65. My income is $1,200 a month. I got a big subsidy. My premium SSA counts resources. No, they don't. Yeah, it doesn't count resources as for Medicare income resources. Well, if you're a high wage earner 2 years ago, you made over $103,000, then Medicare charges an extra premium. But yeah, if you're only making $1,200, yeah, there's Medicare doesn't count resources or anything. You're probably thinking about Medicaid. Yeah, Medicaid. Your state Medicaid probably counts your resources and definitely counts your income because that's a welfare-based benefit. So yeah, that's probably what you're talking about. But there are Medicare Advantage plans out there that pay part of your Part B. They're usually focused on, veterans that have other VA type benefits, and so they're called Patriot plans. But yeah, they have plans that pay for part of your Part B. So if you want to check out and see if there's any of those in your plan, again, email me and I'll have someone reach out to you and give you all your options. 100% for free, of course, no obligation. And if you don't like what their options they give you, just tell them goodbye. Are there gap supplemental insurance plans that we could begin while working with basic insurance as employee benefits, which would continue into when we begin Medicare? No. So the Medicare supplement plans, you have to have Part A and Part B to get a Medicare supplement plan. So thank you. One day would be even better. A spouse and ex-husband are 62 and we're married 10 years. Can she collect Social Security on his record? Yes. will it take away from his earnings? No. What if they get remarried to someone else? Then they lose that benefit. There are very small exceptions if the other person is also receiving benefits, but yeah, it doesn't affect any of the other benefits, other children or new families or anything like that. And but you can only collect if his benefit amount is less than half or more than half of yours. Your benefit amount is less than half of his. Um, but you have to collect benefits on your own record first. You have to file for benefits on your own record first. Um, you can only not file on your own if it's a survivor claim. And I just did a video yesterday, frequently asked questions on survivor claims. So I recommend everybody watch it in preparation for that inevitable day that we move on and shuffle off our motor coil. Dr. Ed, if one signs on to Part B at the 174, does it stay the same price for duration or does it increase? Yeah, it almost always increases every year. Medicare, does the calculation, how much everything is costing, and then they increase it. There was some years in the last 10 or 20 years that the Part B actually went down. But yeah, what last year? But yeah, it goes up usually every year, starting January. Scott, but it goes up for everybody. It doesn't go up for you. It's not like car insurance where if you get in an accident, it goes up. No, it goes up for everybody in the country. So everybody pays the same, unless of course you're a high wage earner making over 103,000, or if you're married over 206,000. So that's called an IRMA. I've done some videos on that one. Scott, if I signed up for an Advantage plan for 10 years and then switched to a Plan N, would it be penalized for starting at 10 years past retirement? No, no. If you're able to pass the health underwriting, but Ns are a little bit more difficult to get into. That's why I always recommend people get into that if they can when they're 65. It's easier to get into a G. That's a guaranteed issue. Sounds like it's guaranteed, but it's not really guaranteed. But N is a little bit more difficult, and that's why everybody thinks the rate increases in the future are going to be a lot less than Plan G. So that's why if you have a Plan G and you're paying $20, $30, $40 a month more than your local Plan N, I would recommend thinking about switching to an N. Because it might be $20, $30, $40 more now, and you're like, oh, that's no big deal. But in the future, everybody thinks G is going to be a lot more. But no, you won't get penalized if you can get in there. And if at that time you have some type of special enrollment period, or you're healthy and you pass the health underwriting, then nope, no particular penalty or anything. They're probably going to adjust it for your age and but no penalty. Robert, my mom is 94, minimum meds. Should she consider switching to an Advantage from straight Medicare? Wow, if she is 94 years old and she just has straight Medicare, she probably has a Medicare supplement. Um, I mean, yeah, it's this. She is an Advantage now. I hate to say without knowing some more information, but and she's probably paying the monthly premium. If she's got like an old F plan that covers everything and her price isn't increasing, then she might just stay where she's at. The medications is a different thing. If she has a Medicare supplement, that means she has a Part D prescription drug plan, because the Medicare supplements don't come with drugs in them like most Medicare Advantage. You have to buy a separate Part D plan. So that's a separate issue. So yeah, I mean, you can reach out, but if she's 94 and she's good where she's been for a long time, then she might just stay where she's at. Again, if price is an issue or something like that, that's what some people do, is they switch to a Medicare Advantage when they can no longer afford the Medicare supplement. So the cola sucks that up. Yeah. Yeah. In terms of, yeah. Yes. Okay. I see what you mean, Kim. That the Medicare Part B premium goes up, but also so the COLA, you get extra COLA, and yes, the Medicare Part B increase usually sucks that up. But Congress has a weird law that a lot of people don't know about. If the COLA increases your benefits, but Part B takes that away completely because the COLA is only like 1% or something, then there's a special rule that that won't happen. So that don't happened about 15, 16 years ago. Yeah. If you freeze Social Security on your FRA, besides the 8% yearly increase, are you entitled to COLA increase as well? Yes, everybody gets the COLA. Um, can you remarried if on IEDS survivors if remarried after 60? So IEDS is only for living spouses. When you start your independently entitled divorce spouse benefits and that spouse passes away, then you're on that day you're now on survivor benefits. So yes, you can, when you're on survivor benefits, you can remarry after 60 years old. Thanks, Dr. Wright. You're welcome. Welcome. Robert, spouse is 62 and filing for Social Security. Does she have to file a separate claim for spousal? Can it be online? Yes, it's two claims, but if you set up an appointment for benefits on her own record, then she just go ahead. If it's a phone call, does that particular claim, and then say, hey, I want to go ahead and file for spouse benefits, then they'll take a spouse claim. So it's two applications, but it can be done at the same time. Yeah. So very, very easy. Done a few 100,000 of those. If surviving spouse is 60, can they collect survivor benefits and still work? Will their income from job be penalized at some amount? Yes. So even survivor benefits, you're still limited to the annual earnings limit, which is the $22,320. So if you earn over $22,320 this year, then Social Security will hold back $1 for every $2 you go over. Once you hit your full retirement age, the annual earnings limit increases substantially before your full retirement age. And then once you're at your full retirement age month, then you can make $1 billion a month and nothing is penalized, nothing is taken back from Social Security. Please be more serious. Putin care. Oh, okay. Let's see here. I have the same income, $1,200 a month in resources at 64 years. ACA only goes income, not resources. As soon as I return 65, Social Security and Medicare counts income, my resources to have, so I have to pay. Again, yeah, Medicare, it's not about your income and resources. Everybody in the country, again, I've done this a few 100,000 times. When your Social Security signs you up for Medicare, they don't ask you how much you're making, how much money you have in the bank. Has zero relevance at all. The only thing they ask you that is if you're early retirement, it does affect your Social Security money benefits, and they'll ask you that to see if you're going to be over the $22,320. But Medicare, you're incorrect. It has nothing to do. You are thinking probably about Medicaid. I watched one of your videos about 1 year rule on Social Security. Can you give a scenario about it? Does it mean collecting Social Security on that new spouse while married and stopping ex-husband's benefits? So the 1 year rule, let me see, there's a few 1 year rules where you can withdraw your application and pay it back within 1 year. Or does it mean collecting so on that new spouse while married and stopping ex? Oh, okay. The 1 year rule. Yeah. Usually, okay. I think this is what you're talking about. You usually have to be married to someone for a year to start the benefits, but if the other person is also receiving benefits, then you can do a spouse claim earlier. So, yeah, watch that video. It's kind of detailed, and it gives the policy reference as well. So, what I would recommend, if you just got married or remarried or whatever the case may be, and you were collecting ex-spouse benefits and now you want to switch to your new spouse, go in and file, and they will confirm whether that 1 year rule applies. But I would definitely because there's so many new people at Social Security. I'd watch that video and get that reference number because I put the reference number in the video. Write down that reference number, RS0020, whatever it is, and then take it down there. And yeah, and that way you're prepared. Kim, thank you for what you're doing. Greatly appreciate it. You're welcome. You're welcome. Let's make sure we get more people out there. To got another person yesterday that found a whole bunch of money because of these videos. I'm not going to say because of me, because again, I just sit here and blabber on based on my decades of experience. It's y'all that get this stuff out to those people. So that lady yesterday got a whole bunch of money because y'all subscribed and shared and liked and all that kind of stuff. That's how we have to teach a stupid algorithm that this is important stuff that we need to send out to more people. So thank you for helping her. She is very, very appreciative. I'm fixing to be 62 and draw on disability on my record. My husband was in disability before he passed away, so I got a small check. Is it more money on his account? I wonder. Yeah, definitely call him up. And if you're going to file for benefits on your own record, you cannot file for disabled widows benefits now because that's only till 60 years old. But I would definitely check out, well, you're already receiving survivor benefits. So you can receive disability and survivor benefits at the same time. And you're probably saying, well, if the survivor benefits are higher, why should I file for disability on my own record if there's no more money? Well, Medicare. If you're 62 years old and they approve you for disability, you'll get your Medicare about a year earlier because you get Medicare after being on disability for 24 months. And so having Medicare a year earlier is probably going to be very nice for you. So possibly if you don't have other health insurance. So yeah, a lot of people miss that. Say, I don't want to file for disability, go through all that stuff. It's not going to be any more money. They forget about the Medicare part. Terry, does Medicare supplement plans have dental and vision? No. And how much would that typically be? Yeah. Once you're done here, click on the description to this video, and I've got a plan there. A company I really like. It's in all 50 states and one of the largest networks, and really good to shop around. So check that out, and it'll give you all your options, 3 or 4 different plans for dental, 3 or 4 different plans for vision, and then see which one is in your budget and which one you want, how much dental you need, how much vision you need. If you just need dental, just forget about the vision part. So, but yeah, Medicare supplement plans do not include dental or vision. Like I said, the some of them are offering kind of discounts, but that's just, discount. So. All right. If you are applying for disability at 63, should you also apply for Social Security at the same time? Should you? It really depends on your situation. Can you? Yes. So you can file for retirement and disability at the same time. It's called a rib-dib. And why some people do that is because Social Security disability takes forever for them to make a decision, at least 6 to 9 months. And some people say, well, I can't be without money for 6 to 9 months or a year. So they file for retirement at the same time and start that retirement check coming in while they're waiting for their disability. But be aware that if you do that and you start your retirement benefits early and you're later approved for disability, depending on when they determine you became disabled, you might get a reduction in your disability benefits for the rest of your life. But it might not be a lot, $7, $15, $20, $30, $40 or something like that. But you say, well, but I need the money. So yeah, when you file, call it for disability, ask them about the retirement thing too, and say, hey, if I did that and I had to wait a year, how much is my disability going to be, reduced? And then you can, make your decision based on all your options, all the information. Is there a cap on Social Security benefits regardless of what a person earns? A cap on Social Security benefits regardless of what a person earns. Well, yeah, I mean, the max that anybody can receive from Social Security is what, 4,800 and something. If you wait until you're 70 years old and you paid max for your entire life, yeah. If you just get it at your full retirement age, what is it, like 3,600 or something? Yep. You can suspend your Social Security and pay back what you've been paid by Social Security. Then you can start Social Security again when you stop working, but you cannot do this with survivor benefits. Um, I haven't had anybody really do it with survivor benefits, but well, I mean, not. You're sounds like there might have been two questions in there, where you can withdraw your application with the one. Oh yeah, we've had some. Yeah, withdraw your application within 1 year and pay it all back. That's one way to, stop or suspend your benefits. Well, that's completely stopped. But if you are receiving survivor benefits, then yeah, you can do the same thing as spouse benefits or retirement benefits. Call up and say, hey, I said I was going to make $22,320 next year, but I got a good job. I'm going to make $100,000. So they will not send you a check all next year. And then they will adjust that amount and unreduce your monthly reduction once you hit your full retirement age. So it doesn't matter if it's survivor benefits or retirement benefits. Um, if you are 63 and applying for SSDI, should you check the box that says you would like to apply for earlier social? Yeah, again, same. It's the same answer there. Let's get some. Ex-spouse passed away. Do I need to file anything to get his Social Security benefits? Yes. So if you're ex-spouse and you're married to that person for 10 years or longer, and you're at least 60 years old, and you are staying under the annual earnings limit, and you're not remarried, unless you're remarried after 60, then yeah, you have to file a claim and get those benefits. If you aren't already on the record, if you're already on the record as a spouse, a living spouse, ex-spouse, then the benefits automatically convert to survivor benefits and you don't have to do anything. It's so confusing, which is the best plan. Yeah, yeah, I agree. They don't make it easy. That's why I recommend, you get someone that knows all the plans in your area and you can trust and is a broker that's just not going to sell you their company. So again, that's why I put together a team like that, because I've seen too many horror stories when I worked at Social Security and beyond of, people not doing the right thing. There's a lot of shady characters out there, unfortunately. And Medicare is actually coming down on a lot of them. And that's another thing that's going to change in 2025. A lot of these, cold calls and, people sharing, someone gets your information because you click a button on Facebook and they call you up and try to sell you and you're not interested, so they sell your information to 1,000 other people, and those 1,000 other people call you all the time and harass you. I'm sure if you're receiving Medicare, some people get 30, 40, 50, 60 calls a day, and that's going to stop. Well, I don't know if it's going to stop, but they're not allowed to do that anymore. So that's a beautiful thing. If you want our help, if you want the help of my team, you have to call me. We don't call you unless you call us or email us and say, "Hey, Ed, have one of your brokers call me up and see what's available in my area, see if there's anything better than what I got, and we can do that." But yeah, we don't call you. We don't have the time to cold call people. Yeah. Thank you for info on the split strategy at 62. Claiming on my record only permanently reduced my spousal claim. Um, so yeah, on a split strategy, it's basically the spouse, the lower earning spouse that's not working or staying under the annual limit, files for benefits, collects those benefits at a reduced rate, but still get that money in their pocket. And then when the higher earning spouse collects later, then they file a spouse claim. And if you wait and file the spouse claim when you're your full retirement age, you get 50%. So there is no reduction. Yours is reduced, but it doesn't matter because you're going to get 50% of that person's. So if you're receiving $200 and they were 1,000, you'll get $1,000 minus your own. So you'll get 200 from your own and then 800 from there. If you waited and got $300, you get $300, and then you're 1,000, so you would get 700 from them, and you're 300. So it doesn't matter what your reduction is; you'll eventually get the full 50% if you wait until your full retirement age. So that is a good strategy. And again, I never talk about taxes. People say, okay, well, I don't want to collect now because that'll put me in a higher tax bracket and it's not worth the $300. So yeah, I don't do taxes. So that's a decision you'll have to make. Let's see. Once the approval of disability is made by Social Security, how long will process before I start receiving the money? Okay, so it really depends on who approved it. If it was approved at the DDS, the State Disability Determination Service, it's usually pretty quick. If it's approved by a judge, then it takes longer. So you go in there and, the judge says, oh, okay, yeah, I agree. You should be, I'm going to approve your case. But then they have to send it to their writer, the case writer, and the case writer has to write it up. And then they have to send that to the local office or the processing center. So if it's a administrative law judge, it takes, yeah, unfortunately, a month or two. And then if there's a lawyer involved, they have to pay the lawyer first. And that takes longer. But if it's a decision, an approval on the initial or reconsideration level, pretty quick, few weeks. Yeah, 2, 3 weeks, simple, easy. I've done several hundred thousands of those too. People ask me, he says, Ed, you say you helped millions of people out, but then you say you've, hundreds of thousands. Which is it? Make up your mind. Hundreds of thousands or millions? Well, I've personally taken hundreds of thousands of retirement, survivor, disability, spouse claims. Personally taken hundreds of thousands. I've overseen the adjudication in my office. We had close to 100 employees. I've overseen the adjudication of millions of those, and I've helped millions through this channel. And I was the strange district manager that I had my entire management team in the lobby every single morning processing the line, getting the line in, getting people put in the correct place. And managers throughout the country hated me because their bosses would go and say, hey, how come you aren't doing what Ed's doing? Ed and his team, the management team gets out of their office and they go to the lobby every single day and help people out. How come you all aren't doing that? So yeah, managers throughout the country hated me. So that's all right. All right. But we provided good customer service. I wish we would have been able to provide better customer service, but what are you going to do? Just staffing. Let me see. I'm going back to understand correctly. Couples married. Did I get this one? If retired 1 month before age 70, can I still get full benefits if I don't take Social Security until 70? So full benefits, yeah. I mean, full benefits are, when you hit your full retirement age, but you're getting the extra above and beyond delayed retirement credits. Awesome. So yeah, if the month you turn 70 is when you get the max delayed retirement credits. So if you start your benefits a month early, you don't get, that full 8%, because it's, not necessarily the year, they do it every month. So it's 8% divided by 12 months. So you might get, $10 less or $20 less or whatever the case may be. So yeah, the month you hit 70 is when you get all of the delayed retirement credits. But be aware that because the Social Security computer system is so ancient, it has a hard time figuring out the delayed retirement credits sometimes. So it'll give you all the delayed retirement credits for, when you 60 year, you had 8, 69. But this last year, because there's probably a few months in there, then it might not give you right now those extra 5 or 6 months of delayed retirement credits for this year. What happens is it will process next year in January. It's just, yeah, but you'll get it. You'll get all those benefits. It's just those last few months you probably won't get until January, but they'll pay you all retroactive. So you'll get it all. So don't worry about it. So the computer system is just old like that. All right, let's see. I've called a couple times and emailed today. I'm hoping some of your selected insurance agent will contact me soon to discuss plan for new retiree. Thanks for. Oh, okay, Sharon. Sure. Um, yeah. I don't recognize the name. Yeah, email me today and say, "Hey, I was on live," and I'll make sure they contact you Monday. So, um, yeah, a lot of times, people screen their calls, and yeah, probably, yeah, because so many people are receive calls from Medicare and they just don't answer anymore. So, email me and I will respond back and I'll tell you the phone number they're going to call from. And that way, yeah, that's usually the issue. People don't recognize the phone number. I remember at Social Security for about a year, our government phone from the office used to say Walmart on it. The caller ID was Walmart. It took us forever to get that fixed, and eventually it came down. It's U.S. government. But yeah, for about a year, people didn't pick up the phones when we called them because it said Walmart, and they weren't interested in talking to Walmart. So yeah, we finally got that fixed. I live in a different. Um, I live in a different zip code than my doctors. Will that make a difference when signing up for a Medicare supplement plan? No, no, not at all. Medicare supplement plans, as I always say, your network is America. So with a Medicare supplement plan, you can go to any doctor in the country. If you live in, Bakersfield, California, and you decide you want to go to the Houston Medical Center, you jump on a plane and go, and you're good. But if you have a Medicare Advantage plan, then yeah, those are the one with networks. But usually, if you're around the same area, the networks. It depends. The Medicare plans, the Medicare Advantage plans, people say, "Hey, I've got a neighbor across the street, and she's got this plan that has $3,000 dental." And then, yeah, I'm sorry, you don't have that available in your area. And she's like, right across the street. Yeah, that's the difference in the Medicare Advantage plans. Is some zip codes, it breaks the line there. Not even the zip codes, it's the same, the other side of the street. And yeah, that your max is dental is 1,000, she's a 3,000. If you move across the street, we can get you 3,000. So but Medicare supplements, yeah, they are pretty much the same throughout the country in terms of coverage. Well, they are the same throughout the country in terms of coverage. Costs are different, but coverage is the same. A G is a G is a G is an N is an N is an N. They're all the same. Um, let's see. Hi, will a Social Security disability lump sum over 13,000 terminate any my Medicaid and SNAP benefits? Yeah, probably. So you definitely need to make arrangements with your Department of Social Services and tell them that, hey, I was just approved for disability and I got a lump sum check of $13,000. But a lot of them, before I worked for Social Security, I worked for the Department of Social Services doing Medicaid and all that stuff. So a lot of them have kind of a spin down where you say, hey, I got that $13,000, but I've been putting off car repairs and I've behind on my mortgage, or I need this. So you spend that money down, then you should be good. So I would reach out to them because they will know that you got that money. So it's better to be upfront, and that way you avoid overpayment and a nightmare and stuff in the future. So call them up wherever your state disability or your excuse me your Medicaid, and say, hey, I got this money, but here's my plan. I've got bills. I need to do this, that, and the other with it. So if I'm on disability and have Medicare, am I eligible for Advantage plans or no? Yes, absolutely. Yes. Um, you are Medicare for Advantage plans, yes, absolutely 100%. If you have Medicare Part A and Part B, absolutely. So give us a call, email me. Medicare supplement plans, it depends on your state. Yeah, Medicare supplement plans, they if states force those companies to provide Medicare supplement plans in your state to people under 65, people that are on disability, then they have to. But sometimes those states say you have to, but they don't regulate the prices, and the prices are like 3 or 4 times as much. So what I recommend for those people out there on disability, if you're on disability and you wanted a Medicare supplement because you didn't like the networks and pre-authorizations, but you couldn't get one because you're under 65, that will change when you turn 65. When you hit 65, you can get a Medicare supplement plan regardless of your disabilities, and you can't be charging anybody else, that's turning 65. So even if it doesn't fit within your, if you don't know whether it fits within your budget, it doesn't hurt to check it out, and see. Ed, you skipped No More Tears. Okay, let's see here. Yeah, I was going back and forth. Okay, there we go. No More Tears. Thanks. It is now 6 months before I turn 65. Is this the right time to call about supplements? Oh, absolutely. Absolutely. It's exactly the right time. So give me a call. Give me your name, phone number, your state, and tell me that you want to check out your Medicare supplement options. And I will have someone give you a call and give you all your options, completely free, of course. Dr. Ed, I did a rib dib, and 3 days later, I received a call from Social Security rep about my dib application. She also sent me from her Social Security email so I can send some docs. 2 days later, my Social Security benefit was approved. Wow, see? Oh, your Social Security benefit was at the Social Security retirement. Yeah, the retirements are super easy to approve. Um, if your disability was approved 2 days, was it your disability that was approved 2 days later? Um, yeah, that's it. It happens. Okay, here we go. No More Tears. Thank you, Kim Joe. Yes, thank you, Kim. Yes, thank you. I got an awesome team here, don't we? That's awesome. The Social Security rep was very helpful and friendly. Ah, there we go. I love to hear that. She told me I can contact her directly by phone or email. Wow, I was really surprised by the great service. Awesome. I don't do shout outs to companies. I don't talk about particular companies. I don't talk bad about particular offices. Always try to stay positive. So, but JRZ, what office was it? Please let us know. Yeah, I like to give shout outs to positive reinforcement. Um, let's see here. Paul, I'm 71 and I want to know if my Medicare Advantage plan. Yeah, nothing else there. So yeah, if you're 71 and with the Medicare Advantage plan, everybody thinks they can only switch during the annual enrollment period, October, November, December. But there's so many exceptions. If you have Medicaid and you have like a dual eligible plan, you can switch several times a year. If you have extra help with prescription drugs, you can switch several times a year. If you have, if there's a 5-star plan, a Medicare 5-star plan in your area, you can switch several times a year. If you move, you can switch. If there's some type of emergency snowstorm, big something, there's it's just amazing how many times all the different exceptions on switching plans. So if you're completely unhappy with your particular plan, give us a call and one of my people will see if there's anything that they can do to upgrade your plan and whether you can upgrade your plan. And if not, then we'll just put you on the list for October when the new plans come out and get you set up there. Thank you. I'm from New Jersey. All right. Let's see here. Sharon, thanks. I am the triple negative stage 3 patient you spoke with by phone recently. I will update my email now and thank you. Okay, perfect. Thank you. Oh yeah. Okay. Yeah. I wonder why. Okay. Yeah. Yeah. Let me follow up on that. Thank you. Thank you. No retirement, Social Security. Okay. Yeah. So it was retirement. Berkeley. Oh, okay, the Berkeley office. All right. So, okay, the regional director out of Richmond there. God, what his name is? Patty. So, yes. All right, Patty, if you're watching, um, Berkeley, North California is doing an awesome job. So, all right. Love Berkeley. Was it the Pizza Council? It's a commune pizza place. Pizzas are really, really good there. Can you please explain TRICARE, please and thank you. So TRICARE is for retired veterans. So like myself, I was a sergeant in the Marine Corps, but I was only in 8 years. 8 years in the Marine Corps is like, 20 everywhere. But anyway, I won't go there. But TRICARE is if you actually retired from the service, or sometimes disability retirement. So yeah, if you have TRICARE, you have to sign up for Part A, Part B. And in terms of a Medicare supplement plan, no, don't get a Medicare supplement plan if you have TRICARE, because it's just too much, and you don't want to spend that money because you've already got TRICARE from the military. Some sign up for Medicare Advantage plans to get a few of the extra benefits, but yeah, I would just stay with TRICARE there. People are pretty happy with TRICARE. Is TRICARE a supplementary or is it an addition to a supplementary? Yeah, so no, TRICARE is something all in its own. So it's for retirees. So you won't need a Medicare supplement plan. Definitely not a Medicare supplement. A few percentage of people get a Medicare Advantage plan, but you definitely have to get Part A and Part B. They require you to get that. I'm turning 65 soon and trying to decide which insurance company to go with. All right. So yeah, if you're looking at a Medicare Advantage plan, I wouldn't, worry about the company necessarily. I would look at the plans. And number one thing you do with a Medicare Advantage is you find out which one covers the doctors you want to continue seeing, and then you get your prescriptions, and then figure out which one has the best price for prescriptions. And then you look at all the other stuff, how much for hospitals and the benefits and all that other kind of stuff. So it's more about the plan than the company itself necessarily. And with a Medicare supplement plan, it's most about the price because they're all the same. However, the price, here's my recommendation. The price amongst the largest national Medicare supplement plans, there's 4 or 5 that are the biggest. And those are the ones I would recommend finding the lowest price of those 4 or 5. But because in your area, there's probably a Medicare supplement plan that's cheaper maybe than those. But because when you sign up for a Medicare supplement plan, you're going to be on that for decades. And if you sign up for, East Southern Texas firefighters Medicare supplement plan, that's, very, very small. And 10 years from now, 20 years from now, is it still going to be around? So I would pick one of the big companies, and then within those big 4 or 5 companies, then you pick the cheapest priced. Yeah, that's what I recommend. Does Medicare count retirement annuities as income? Nope. Medicare. In terms of the Medicare supplement, um, the surcharge. Yes, I did a video on that. Yeah, like a Roth IRA and stuff like that. Yeah. So if you're making 2 years ago, if you earned over $103,000, then yeah, you might get hit with a Part B surcharge above and beyond the $174. So, all right, we are over an hour. So let's do one more. Do we have anybody that has never asked a question? Let's see here. So I'm jumping around here. Okay, I don't think I recognize Lewis here. One-time lump sum death payment of $255 can be made to a qualifying spouse if they meet certain requirements. What are they? They have to be married to the person, and living with the person. So because that $255 is supposed to go for burial insurance, burial, $255. Yeah. So that's another reason I've put together brokers that also do burial insurance, because $255, come on. So it doesn't go to ex-spouses or divorced spouses. It can go to children if those children are currently receiving benefits on that record as surviving children. We get, calls from, um, you know, children under 30, 40, 50 years old. And how do I get my father's lump sum and survivor benefits? And said, yeah, no, unless you're receiving benefits, you don't get the 255. So yeah, so the qualifying spouses, you got to be married and essentially living together. Because again, that $255. But living together, that's kind of hard to prove. If you're currently married to that person, then yeah, and it's $255. So All right, that'll do it for today. And if I missed your question, didn't answer your question, where do I email you? Can you but have double vision? Oh, it's ed at mygovexpert.com. Mygovexpert.com. Ed at mygovexpert.com. All right, y'all have an awesome night and have a beautiful day, and we'll see you next time. Take care.